marrow biopsy. Bone marrow is the soft tissue present inside the bones which helps to produce blood cells. It is present in the hollow part of long bones.
It contains cells that produce white blood cells, red blood cells, and platelets. White blood cells help fight against infections. Red blood cells carry oxygen inside the body and nutrients, and platelets enable the blood to clot. What is bone marrow aspiration? Bone marrow aspiration is the removal of a small amount of bone marrow in liquid form for examination. What is bone marrow biopsy? A bone marrow biopsy is a procedure that takes a small sample of marrow from your bone. Why the procedure is performed? This procedure is performed to find the reason for a low number of any kind of blood cells or to assess the reason for high number of any kind of blood cells and to assess any other disease conditions for say any kind of leukemia, Hodgkin's and non-Hodgkin's lymphoma or multiple myeloma. This procedure is also helpful to monitor the response of a treatment for leukemia patients and to determine how far certain lymphomas or carcinomas have progressed. How are these tests done? Bone marrow samples are usually taken from the top of the pelvic bone. This is the bone that can be easily identified just below each side of your waist. Occasionally, other large bones can also be used, such as breastbone. You will be asked to lie on a bed on your stomach or your side, depending upon exact site from where doctor is going to take the sample. The skin over the bone to be sampled is cleaned with aseptic technique. Some local anesthetic is then injected into a small area of skin and tissues just over the bone. This stings a little at first, but then makes the skin numb. Some people are given a sedative before the procedure. To aspirate bone marrow fluid, a needle is pushed through the anesthetized skin into the bone. A syringe is used to draw out some liquid bone marrow. As the liquid is withdrawn, you may have a brief sharp pain in your bone. Take a sample, that is biopsy of bone marrow. A second thicker hollow needle is inserted into the bone. This is rotated around as it is pushed slightly forward to force a small sample of bone marrow into the hollow middle of the needle. This may cause some dull pain for a short time. The needle is then taken out and a pressure bandage applied to prevent bleeding. What are the risks of bone marrow aspiration and biopsy? Bleeding, which is very rare. Then there is a small risk that the site where the bone marrow was collected will become infected after the biopsy or aspiration procedure. Preparation before test. Have light breakfast before coming for this procedure. Tell your doctor if you have previously had an allergic reaction to local anesthesia. After the procedure, apply pressure over the bone marrow aspiration or biopsy site minimum for 20 minutes. Remove the dressing after 24 to 48 hours. You may feel sore at the biopsy site for several days. Ice pack can be used for that site, and pain medicines which your doctor will be prescribing you can take that. Tell your doctor if you have any of the following problems after the procedure: fever, which is equal or more than 101 degree Fahrenheit, uncontrollable bleeding, unusual discharge or severe pain at the needle insertion site, any other sign or symptom of infection.